All right, today on Med Rounds, we are addressing the rising mental health crisis. Hartford Hospital's Institute of Living has been awarded a special grant from the National Institute of Mental Health.
And the research will utilize artificial intelligence to better personalize treatment options for a wide variety of mental health conditions.
Hartford Healthcare's Dr. Godfrey Perlson is the head of the Olin Neuropsychiatry Research Center at the Institute of Living, and he is joining us now with more so we can better understand. Dr. Perlson, thanks for being here. So what are we seeing when it comes to mental health right now?
So, yeah, just to give you some context, and good afternoon, by the way, this is a $20 million 5-year grant from the National Institute of Mental Health, and it's both to investigators at Yale, Christopher Pittenger and Sarah Yip, and to us at IOL. And we're looking specifically at patients with psychotic disorders, such as schizophrenia, and adults with ADHD. And the overall grant is looking at patients with 16 different diagnoses. And the idea is that if I have a psychiatric diagnosis, such as depression, let's say, then not everyone with depression has the same illness or responds to the same treatment. There's considerable heterogeneity or difference even within a single diagnosis. What we're trying to do is use state-of-the-art methods to figure out what those different kinds of subtypes are and who responds to which treatment. So we're identifying them through methods such as wearables, like how much activity is a person having in a day, or how often are they using their social media, or if you give them a little cognitive game to play on their smartphone, how clearly are they thinking? Or if you ping them on their smartphone a couple of times a day and ask them how their mood is, how do their moods cycle over time? Or if you record their voice and play it back, if the person's starting to get depressed again, are they speaking more slowly? Or are they not speaking as much? So we're tracking those sorts of metrics.
And Dr. Perlson, how will AI machine learning help specialize treatment options for mental health conditions?
So, for example, if you or I had a voice or a video recording at baseline, when we're well and have very few symptoms. And we can watch how that changes over time. And if you or I listen to our voice recording, we may say, well, it sounds a little bit different from the way it did 3 months ago, but it's hard to say why. Then artificial intelligence or machine learning can give you very precise quantitative measurements, like the number of decibels is 10% louder, or the person is speaking 4% slower, things that are otherwise very difficult to capture. Wow. And we think by having that degree of precision, we can really track people's moods and symptoms over time more accurately than a clinician can in a doctor's office.
Doctor, very exciting to be able to use this technology to help people's mental health. Thank you for being with us today. And for more information, to learn more about this, you can go to hhcbehavioralhealth.org.